Let's talk about non-surgical approaches to hair restoration or a non-surgical program. It's based upon ACS and our at-home therapies. If you watch our video on what causes hair loss, you'll have a much better idea of what therapies we're choosing and why. But just a quick review of what's going on with your hair. Testosterone is converting into dihydrotestosterone or DHT. DHT is binding to your hair follicles with DHT receptors. And those are the hair follicles that are in the patterns of loss, usually in the crown, the top of your head, and in your temples, but not along the sides and the back, the hairs that have DHT receptors. Once DHT binds to those hairs with the receptors, it's going to cause metabolism of those follicles to go down. That's going to cause a progressive thinning of the hairs over time, not shedding, it's progressive thinning. At the same time, the body's going to respond to that decrease in metabolism by shutting down the blood supply, and this blood supply is going to get progressively smaller and smaller, and that hair is never going to grow thicker than that blood supply allows. So in non-surgical hair restoration, we're looking for hairs that can be revitalized or thickened back up again. And these are specifically hairs that have not decreased beyond 1/2 of their original width. If a hair is 1/2 its original width or thicker, I might tell you that it's actually worth it to try to rejuvenate it with these medical therapies. So there are 3 areas along this pathway which we're going to try to attack. The first one is DHT. We're going to try to block the conversion of testosterone to DHT. The best agent we have for this by far is dutasteride. It is the 2nd generation of finasteride. If you've been on finasteride, you should switch to dutasteride because it is more effective with the same side effect profile. It is available as a topical and as an oral. For most men, I would recommend taking it as a topical. Second, we have ketoconazole shampoo. Now, this is way less effective than dutasteride. However, it is very easy to use. You can use ketoconazole shampoo every other day before you shower, and it'll decrease the DHT levels in your scalp by a small amount. And then we have some supplements such as Nutrafol and X-Trace. A lot of them have DHT blocking agents in them, like sal palmato, ashwagandha. These things block DHT and block that first step, which is DHT getting produced, which is then going to go thin out your hairs. So we're going to block that step first. The second step in a non-surgical treatment is increasing the metabolism of the hairs. We want these hairs to grow thicker again. And by far, the best way to increase the metabolism of the hair is with an in-office treatment called ACS. And this is the staple of the non-surgical program. Everybody's going to get ACS. You come in for 4 sessions, 6 weeks apart. What is ACS? It's autologous conditioned serum. It is a wound healing therapy. Well, why does wound healing therapy make a difference? Well, in healing a wound, you got to get skin and hair cells to replicate, which means you got to increase the metabolism of the hair cells. At the same time, in wound healing, you got to get new blood vessels to grow into that wound such that it has the nourishment to actually heal. ACS provides the means of increasing the metabolism of the hairs as well as growing new blood vessels. When you go home, you can actually increase the metabolism of your hairs by a slight amount as well with laser caps or microneedling. Microneedling are little needles on a roller. You just roll it over your skin, and you're actually causing wounds, and you're inducing the wound healing response every week at home to a very light degree. But it's the same principle. You're getting the hair metabolism to kick up, and you're trying to get the metabolism of the hairs to cause the hairs to grow thicker and demand more blood supply from the body. Laser caps work in just a very similar but a little different way. It's actually using photomedicine. It's actually using a very specific wavelength of red light to excite a chromophore or a light absorbing molecule within the follicle itself. This is going to increase the metabolism of the follicle while the laser cap is on. At that time, that follicle is then going to demand more blood flow from the body, increasing the blood supply and the metabolism of the hairs while you're using the laser cap. All right, step 3 is actually increasing blood flow to the hairs. And this is good old minoxidil, Rogaine. A lot of people don't know that Rogaine is just a blood pressure medication that was found to cause hair growth, and it's because it's specifically good at dilating the blood vessels in the scalp itself. Basically provides more blood flow to follicles. So you can take Rogaine topically or you can take it orally. And either way, it's one of the best ways we have to augment blood flow and increase the stimulation of hairs. Now, taking Rogaine alone obviously hasn't blocked the effects of DHT, and that's why a lot of people say, hey, Rogaine, if you come off it, you actually go back to a worse position. Well, that's not true. Rogaine helped you. You just never blocked the hair loss from happening underneath the process. You were just kind of masking it. We also talk about laser caps and laser caps and microneedling as also being ways to augment blood flow at home. In non-surgical hair restoration, we're trying to get hairs that have the ability to grow thicker, the ones that are 50% original width or more, to essentially thicken up. We have 3 points in the pathway we're trying to attack: the production of DHT, increasing metabolism of the hair follicle itself, then increasing blood flow. And we do this as one program, which are coming to your office for 4 treatments of ACS, 4 sessions, 6 weeks apart, creating a perfect environment for these hairs, a wound healing environment. At the same time, we're working through your home regimen, figuring out which one of these is the best fit for you. Is it topical dutasteride? Is it oral? Is it oral minoxidil or topical minoxidil? Are we using a laser cap? Are we doing microneedling? Whatever it is, we hash all these things out in those 4 sessions, and that's how our non-surgical program works.